So today we'll talk a little bit about what is Updox and what we're all about. We'll also discuss some of your key challenges that we are hearing every day from pharmacists like yourself, and some of those challenges, what they bring as far as being very difficult for you to overcome, and how we can help overcome that with some of our solutions. We'll also talk a bit about our pharmacy systems that we're integrated with, how to get more information, and then as Megan mentioned, we'll have time for questions at the end. So who's Updox? Updox is your single source for patient and provider communication. We know you all do a great job serving your patients in your pharmacies. We want to help your communication in and out of your pharmacies. We were founded in 2009 by healthcare professionals, and we really are the leading communication platform across many different centers of care, including pharmacists, physicians, and other care settings. We have integration with 5 major pharmacy management systems and 70 plus EMR integrations, and we continue to grow. It's one of our specialties we have, working well with other systems and exchanging data. You can see here that our network is rather large. We have over 300,000 users, 56,000 physicians. We have 72 million patients in our database, and we have 8.5 million patients have actually created patient portal accounts on our patient portal solution. We also have over 1 million direct email addresses in our global directory that allow medical professionals to securely communicate with one another. So what are some of the key challenges that we are seeing and hearing from today's community pharmacists? We constantly hear that the paperwork and the faxing that has to be done, how time consuming it is for you all, it's inefficient, it's not secure, and it really is just a very manual, labor intensive operation that you'll have to do on a daily basis. You also have to deal with the regulatory compliance and legislative regulations constantly changing. And you have to make sure that you're following obviously all those regulations in order to stay in business. We also are hearing a lot of concerns over patients not adhering to their medications. And so we understand how important that is in order to have great outcomes. The patients really need to adhere to the plan you're putting in front of them. We also know that there's an increased and expanded scope of professional responsibility that pharmacists are being asked to take on as we move forward in healthcare. And we also understand that you all are very qualified and have all the necessary credentials to do that. And now we want to be able to help you take on these responsibilities with tools and technology. There's a constant pressure right now for community pharmacists to remain independent. You like being independent. That's a big part of why you are a community pharmacist and not with one of the larger chains. But obviously, in order to be able to remain independent, you have to be financially viable and profitable in your day-to-day business. And part of that is how do you maintain and attract new patients from the national chains, and really even starting on things like when they're discharged from the hospital or leaving the care of a care provider. You want them to come to your pharmacy. So talking about some of the challenges around reimbursements and audits, we know that the rising drug prices and there's lower margins on prescriptions. I've heard multiple stories about how in some states some of the Medicaid reimbursements actually are not enough even to cover the cost, and pharmacists are losing money. So we know there's a huge challenge there on lower margins for prescriptions. There's also a lack of transparency with the pharmacy benefit managers and the formularies. The MAC prices may be inaccurate and outdated, and we all know that the lack of visibility into how the PBMs work and manage all the reimbursements is really a sensitive and frustrating topic for pharmacists. Audits. You have to deal with audits. These expensive, random, and interrupting audits that are, again, labor intensive and really require that you're able to get information that's probably all over your pharmacy. So, having to keep records for X number of years, hard copies versus electronic copies. I go into a lot of pharmacists and see a significant amount of shelf space with these hard copies of documents, of prescriptions that have been there for who knows how many years. Another big challenge is your patient's adherence or lack thereof. You put together a plan working with the physician to put them on a medication regimen. They don't adhere. Sometimes they don't even come to pick up the medication or the prescription. And really, these new workflows are really designed to help you drive and increase adherence, like medication therapy management, medication synchronization. These are different services that you can deliver to hopefully help with the adherence of the medication so the patient can receive better outcomes. However, if they don't adhere, we start to see these penalties, such as the DIR fees, these clawback fees that have become so prevalent in the news, and really are another source of extreme frustration for those of you who are obviously trying to run a business and make profits. These DIR fees are unexpected, an unknown surprise whenever they come in. And also, if your patients are not adhering, you may be excluded from certain limited and preferred networks that really insist upon certain levels of performance as far as medication adherence. Another challenge, and I know all of you all deal with this on a day-to-day basis, is just remaining competitive. How do you compete against the national big box chains? I think we all would agree that it's going to be very difficult going forward to compete against them around price when it comes to prescriptions. You also have a relatively new competitor in the PBM mail order space. And so it's really, and then you also have a challenge around modifying your business. So you recognize the fact that you're going to have to expand your services, but expanding your services means that you've got to change, maybe you have to change some of your core businesses. How do you offer immunizations and vaccinations? Do you have space for compounding? Do you have the ability to provide scheduling tools so that patients can schedule their medication therapy managements? Do you have what you need in order to do medication synchronizations? All these services are great services that you can offer, but it means you may have to change your business, and we understand that's a challenge as well. We also understand that clinical collaboration with physicians is tough, and it's also manual and time-consuming. Physicians, they don't want to go out of their workflow to communicate. They are typically in their electronic health record all day, every day. They don't like to go out of that. There really is no good, secure communication between you and your staff and the care providers to discuss patient care. You've basically got a phone and you've got a fax machine, neither of which are secure and certainly not automated enough, or there's certainly very manual things to do and time-consuming to communicate with. And RX refills and clarifications, these can be frustrating and time-consuming. I've told multiple stories where prescriptions will come over and there's mistakes on it, and a pharmacist just wants to get a simple clarification that can take hours, if not days, to actually get an answer back. And these could be for medications that are very important or time-sensitive for the patients. So this is a constant source of frustration for pharmacists. There's also poor transfer of information, and that means that care coordination is really difficult because everything is so manual, the faxing, the phone calls, those kind of centralized way to communicate. It's just a poor transfer of information. And that makes it labor-intensive and inefficient. And honestly, a lot of pharmacists will tell me that it's very difficult to do a lot of these services because they feel like they don't have the tools to collaborate with the physicians, and they don't have a good way to inform the physicians, the patients, and everybody else who's involved in the patient's care. Patient engagement. This is an area where it's a challenge really for a lot of different sectors in healthcare, and the same thing applies to use a community pharmacist. You don't really have the tools to communicate and schedule services, or the patients don't have the tools to communicate and schedule services with you. So if you want to expand, or when you're ready to expand your services, and you want to give them a way, for example, to schedule medication therapy management, how are they going to do it? Are they going to call? Wouldn't it be great to have other tools that are more sophisticated where they could go on and pick their slot to come in for an MTM or for an immunization, or really for maybe even for a batch of immunizations that apply. There's really no good way to notify patients, especially in mass, so you have to call them all. and that's really like the only way, unless they come in the door and you can communicate with them face to face. But there's really a need for more sophisticated and more variety of patient engagement tools out there to really to provide the patients with the options that they want to be engaged from a clinical perspective. Collecting info is hard. It's all paper-based. Things like forms for workers' compensation. It's paper. It's many pages. It takes a while. The patients get frustrated. So finding better ways to do that would also be a big benefit. Y'all really don't have a good way to close the loop for things like immunizations. Many states you have to follow up with the provider to let them know the immunizations that were given to patients, and there's really no good way to do that. It's almost always just faxed over, and that's about the end of it. It gets sent over that way, and you're not really even sure if there's any feedback loop from the provider on that. Also, there's no access to after-hours services for patients. If they need help or if they need to get information when you're not open, there's no way to do it. So there really needs to be ways to provide patients with the ability to get help when they need it, even if it's not during open hours. Okay, so now I'm going to kind of talk about how we, as Updox, can help you avoid looking like this. All those challenges I just went through, we understand and we feel your pain. We want to help alleviate many of these by providing tools and technology that will make your day more efficient and that will make some of these manual processes a lot easier, a lot more automated. And how we do that is really with a tool that helps link the pharmacist to the entire care team as well as the patients in an efficient and streamlined and secure way. And that's Pharmacy Connect. So Pharmacy Connect is our product that provides the pharmacist with the tools they need to be able to communicate with the care providers, with patients, with other pharmacists, with anyone who's involved in care, even the patient's family, through tools like direct email, secure messaging, electronic faxing. Again, the faxing component that we offer is electronic. It's secure. You don't have to have a fax machine. It's all done securely through our portal. Patient messaging, notifications, payments. All these capabilities give you the ability to take your communication around patient care and around anything that needs to be sent securely using our tool in our unified inbox. And so if you think about some of the challenges you have, the phone calls are not going to go away. We know that. But boy, wouldn't it be nice to severely limit or decrease the number of phone calls that need to go in and out of your pharmacy. Also, the number of faxes. How much paper is coming in? How much are you spending on your fax machine, your fax line, all that? Those are some things that you may not think about, but that fax machine is costing you a lot of money. And with this Pharmacy Connect tool, we can really help with those costs, and everything is in one place. So that's a big advantage of having kind of your consolidated inbox, your centralized communication center. So what this means is we can help solve the challenges of managing the communications, including things like transition of care and any sort of PHI that you have to communicate between your pharmacy and the patient, your pharmacy and the care provider, your pharmacy and anywhere else, even the payer, other places like that you need to get information to. We give you a secure way to do that. Also, you can communicate faster. With direct messaging is integrated directly into electronic health records of the physicians, so you can securely communicate right in their workflow. Much more likely that they're going to receive that message and respond back in a timely manner. Also, we help solve the challenges around engaging patients by offering convenient online customer service tools like our patient portal, as well as blast messaging and appointment reminders. These are all things to keep your patients engaged and thinking about their health and helping them adhere to the care plans and to the medication plans that you've put in place for them. We also help you drive clinical services revenue, really through improving your care coordination process. I've heard from a lot of pharmacists that they really don't like doing like the medication therapy management and other sorts of services because it's a lot of work and a lot of time and not enough reimbursement to justify unless you do it at a high volume. Well, some of that's just around the efficiencies. We can help with that so that you can say, hey, this is worth it because I've got the tools to make these go faster, and therefore I can do more of them, and therefore I'm going to make more profit on those services. And also, just being able to improve your customer service with better communication and access. People expect these sort of things in this modern age. They expect to be able to go online. They expect to be able to access things from their mobile device. They expect to be able to do things electronically and not have all these manual paper processes. I mentioned before about how you can increase your efficiency and reduce your costs just by getting rid of your fax machine. So just think about how much you spend. Most pharmacies and practices we speak to spend between $35 and $45 a month if you consider the cost of the phone line, the paper, the toner, all the things that go into a fax machine. Well, with our solution, you can get rid of that fax machine altogether. Also, you can improve your cash flow with the ability to take online patient payments. You can put a credit card on file. I know many pharmacists allow you to charge, and then they'll send you a bill at the end of the month. And and by having the ability to pay this online and having a credit card on file, you can make that so much easier for you and your staff and your patients. So kind of what's some of our differences? What's some of our key differentiators that make Updox special in offering technology and solutions? We have it's a web-based solution, so no hardware required. All you have to have is a browser and internet access. We have a monthly subscription. So you pay a monthly subscription for the service. It's a consolidated inbox. So again, what does that mean? It means everything comes into one inbox. So all your faxes, all your emails, all your secure messages, all the messages from the patients, all come into one inbox that can be managed by you and your staff. Same thing to send things out as well. You can take one communication and send it out to a number of different recipients, and you can even send it different ways. So you could send something via direct messaging to the doctor. You could send that same document to someone else via fax, and you can also send that same document to the patient, all in one inbox in one composed window. So very convenient and efficient. It's easy to set up and manage. The training and onboarding is super simple, doesn't take hardly any time at all. We can get you up and running very fast. And that's very different from a lot of systems from a technology perspective. Also, access from anywhere. We talked about this, the ability to do access from home. Imagine situations where you're not actually in the pharmacy and you want to go check your inbox to see if a patient's responded back on a medication change, or if you're waiting to hear something back, you can check from your phone or from your iPad. And the ability to access from anywhere is a big boost. So you don't actually have to be in your pharmacy to use the system. And the tools are very pragmatic. Like I mentioned, fax is not going away. We know that, but let's make fax as efficient and secure as possible. And that's what we've done with our electronic fax solution. And the other tools that we have, again, around direct secure messaging, really providing secure ways for you to communicate with everybody involved in patient's care. And also, I can't emphasize enough how important it is to be in the physician's workflow. Much more likely you get an answer from them or really enable consistent communications with those providers you work with a lot by having a tool that's integrated right into their workflows. I want to talk a little bit about our pharmacy systems integration. We know that as a community pharmacist, you've got a particular pharmacy system that you do all your medication prescriptions and reimbursements from, and we've integrated with a lot of those systems so that system and our system work very closely together and make it easy for you to use both. So one of the things we've done with a lot of these partners that you see here is we're bringing over your patients and the prescribers from your pharmacy management system and populating your instance of Pharmacy Connect. That means that when you go into Pharmacy Connect, all your patients will be there, all your prescribers and contacts will be there, so you're ready to start communicating with your patients and all the care providers that you work with. We do a one-time historical load on initial implementation, and then we do a nightly data sync to make sure that the information stays up to date. You can kind of see an idea of our release timeframes around our different partners that we have. We also have worked very close with Creative Pharmacists. You may or may not be familiar with Creative Pharmacists, but they are really the leader when it comes to clinical documentation, specifically around being able to record pharmacy-based findings and generate the new e-care plan. And we are the platform that will be used for Creative Pharmacists to communicate these e-care plans. We've got, they're integrating the direct messaging and their inbound fax capabilities into their Strand platform. So they're using Updox as their backbone, and that's available actually in Q4. So this quarter of 2017, they'll have that available and be rolling it out. That will allow people who have Creative Pharmacists to communicate the e-care plans that are becoming really a new standard in how to communicate, how to document and communicate clinical care for pharmacists. Here's a customer quote from Beth Bryan, and you can kind of get an idea of some of the key factors for her. The solution is easy to use. They're quickly saving money with it because it's low cost, and it's also saving their staff a lot of time. So I think those are some of the key value propositions that we offer. It really is. It's around saving time, low cost, and very quick to get up and running. So if you want to get started today, here's the information. You can call 614-798-8170 and click option 1. You can also email our sales team. And if you want to find more information online, you can go to our website, and the web